Once again, you are welcome to Angel Health Academy. Subject: Community Health Nursing, Mnemonic. Topic for the day is Family Counseling or Family Therapy. Family Counseling or Family Therapy. The synopsis includes introduction, meaning, definition, family stressors, goals, aims, indications, principles, types, functions, techniques, approaches, stages, benefits, contraindications, and role and functions of the community health nursing, family therapy or family counseling. Let us discuss in detail one by one. Family is a group of individuals. They interact, support, and influence each other in performing basic functions. Group of individuals interact, support, and influence each other in performing basic functions. Family are an integral part of the society. They bound together by intense and long-lasting ties of past experience, social roles, mutual support, and expectations. Family crisis. According to Kaplan, 1964, family crisis occurs when individuals or families encounter stressful situations and normal coping mechanisms fail to resolve the disruption. Family crisis occurs when individuals or families encounter stressful situations and normal coping mechanism fails to resolve the disruption. Family counseling is a type of therapy that can help families with any of the issues they may be facing. Usually provided by psychologist, clinical social worker, or a licensed therapist. Meaning of family counseling. Family counseling is a type of psychological counseling or psychotherapy that helps family members to improve the communication and resolve the conflicts. So it is a type of psychological counseling or psychotherapy that helps family members to improve communication and resolve conflicts. In other words, family therapy is a method of treatment in which family members gain insight into the problems, improve their communication, improve functioning of individual members as well as the family as a whole. Family therapy also referred to as couple and family therapy, marriage and family therapy, family system therapy, etc. Definition of family counseling or family therapy. According to Bowen, 1988, family therapy is a psychotherapeutic approach that focuses on interaction between a couple within nuclear family or its members in extended family, or between the family and other interpersonal system with the goal of alleviating problems initially presented by individual family members, family subsystems, the family as a whole, or other referral sources. According to Bowen, 1988, family therapy is a psychotherapeutic approach that focuses on the interaction between a couple within a nuclear family or its members in extended family, or between the family or other interpersonal system with the goal of alleviating problems initially presented by individual family members, family subsystems, the family as a whole, or other referral sources. According to the Journal of Family Therapy 2014, family therapy or family counseling is a form of treatment that is designed to address specific issues affecting the health and the functioning of a family. It can be used to help a family through a difficult period, a major transition, or mental or behavioral health problems in family members. Next is family stressors. The stressors can be classified into developmental stressors, internal stressors, external stressors, and situational stressors. That is, stressors usually kills the people, dies. Developmental stressors, internal stressors, external stressors, and situational stressors. Family stressors can be classified into general stressors and developmental stressors. That is, general death, general stressors and developmental stressors. General stressors includes family relationship issues, conflicts, communication problems, health issues, behavioral problems, financial issues, sibling rivalry, addictions, others. Developmental stressors includes marriage, first child, first teenager, gender role change, children leave home, old age, death of one of the parent, others. Next is goals of family therapy. Major goal of family therapy is to facilitate positive change in the family. Other goals are, one is fostering open communication of thoughts and feelings among family members, promoting optimal functioning, that is interdependent roles, promoting interdependent roles of the family members. Next is aims of family therapy. There are 5 main aims of family therapy. First one is to change the relationships which produce the pain in the family members, to change the relationships, to establish good communication pattern among the family members. Third aim is to improve integration of family system into societal system, to improve the integration of family system into societal system. Fourth one is to assist to locate the community resources. The fifth aim is to reduce anxiety, stress, and establish balance in the family members. Then indications for family counseling. First indication is failure to individual therapy. The problem lies in the family rather than an individual. So problem belongs to a family. Facing transitional change in family life cycle. When the family face transitional change in family life cycle, communication problems, substance abuse, schizophrenia, childhood psychiatric disorders, psychosis, anxiety disorders, stress, and others. So these are the indication for family therapy. The next session is principles of family counseling. Principles of family counseling. Family therapy is based on the principle that change your behavior and you will change your relationship. So family therapy is based on the principle of change your behavior that will change your relationship. The second principle is the family system itself is more influential than individual conflicts in producing abnormal behavior. The family system itself is more influential than individual conflicts in producing abnormal behavior. The third principle is in the structured family therapy, change the origin of the family in such a way that family members behave more positively and supportively towards each other. So in the structured family therapy, they change the origin of the family in such a way that family members behave more positively and supportively towards each other. These are the 3 principles of family therapy or family counseling. Next is types of family therapy. The important types of family therapies are conjoined family therapy, concurrent family therapy, collaborative family therapy, individual family therapy, couple family therapy, multiple family group family therapy, multiple impact family therapy, network family therapy, and others. Conjoined family therapy means the entire family is seen at the same time by one therapist. So when entire family members seen a therapist, that type of family therapy is called as conjoined family therapy. In concurrent family therapy, one therapist see all the family members but in individual sessions. Third one is collaborative family therapy. In collaborative family therapy, each family member sees a different or separate family therapist or counselor. Couples therapy. In couples family therapy, couples are often seen by the therapist together. In multiple family group therapy, the 4 or 5 families with a common problem meet weekly to the family therapist to confront and deal with the problems or issues they have in common. So 4 or 5 family meet weekly to the therapist with the common problems. In multiple impact therapy, several therapists come together with the families in a community setting. So several therapists meet the families in a community setting is called as multiple impact therapy. Network therapy is conducted in people's home. All individual interested or invested in a problem or crisis that particular person or persons in a family are experienced take part in the network therapy. So network therapy is conducted in people's home. Then others. There are many other types. In that one is multi-systematic therapy. It was developed for juvenile offenders and their families. Treatment is delivered in the person's home, schools or other community locations. Therapists are available for the consultation for 24 hours a day into 7 days a week. So next is functions of family therapy. Functions of family therapy is as same as functions of the basic functions of the family. That includes boundary functions. Create a boundary in the family. That make a distinction between the family members. Then communication function, supportive function, socialization function, biological function, psychological functions, educational functions, protection functions, recreational functions, religious functions, cultural functions, and social functions. So these are the 12 functions of the family therapy. That is boundary functions, communication function, supportive function, socialization function, biological function, psychological function, educational functions, protective function, recreational functions, religious function, cultural function, and social function. The next session is techniques used in family therapy. There are mainly 5 techniques in family therapy, which includes family system approach, observation, effective communication, problem solving, and psychoeducation. Family system approach. Family system approach means involving entire family members in the family therapy. Involving entire family members in the family therapy is called as family system approach. Then other technique is observation, effective communication, solving the problems of the family, and educating the family members. That is psychoeducation. So these are the family therapy techniques. The next session is approaches used in family therapy. Approaches used in family therapy. I have made a mnemonic for family counseling approaches, that is therapies. THERAPIES. Let us expand therapies. T stands for Transgenerational or Bowen's approach. H stands for Haley's strategic or interactional approach. E stands for Experiential Approach. R stands for Relationship Counseling or Relationship Approach. A stands for Anderson's Social Constructionist Approach. P stands for Psychoanalytic Approach. I stands for Integrative Approach. E stands for Elli's Cognitive Behavioral Approach. S stands for Structural Approach. So approaches of family therapy includes Transgenerational Approach, Haley's Strategic or Interactional Approach, Experiential Approach, Relationship Counseling or Relationship Approach, Anderson's Social Constructionist Approach, Psychoanalytic Approach, Integrative Approach, Elli's Cognitive Behavioral Approach, and the Structural Approach. Let us explain one by one. The first approach is Transgenerational or Bowen approach. It consists of both emotional and relational system. Emotion and relation. According to Bowen 1978, individual's behavior is a response to the functioning of the family system as a whole. This approach is based on the Murray-Bowen's theory of family emotional systems theory. Bowen's approach focuses on guiding one or more family members to become a more solid and defined self in the face of emotional forces created by marriage, children, or the family of origin. So this Bowen's approach focuses on guiding one or more family members to become a more solid and defined self in the face of emotional forces that may be created by marriage, children, or the family of origin. The next is strategic or interactional approach. This approach is developed by Virginia Stair and J. Haley. So Haley's strategic or interactional approach. This approach is based on the communication theory. The goal of this approach is homeostasis among family members and look at patterns of interactions between the family members. Strategic approach deals with the interpersonal relationship among the all family members. Here the therapist study the interactions between and among family members and recognizing that change in one family member occurs in relation to change in another family members. This is about a strategic or interactional approach. The next approach is experiential approach. Experiential family therapy is developed by Stair. The emphasis of experiential approach is affect. A healthy family is one in which people openly experience life with each other in a lively manner. So this approach is based on a healthy family is one in which people openly experience life with each other in a lively manner. The goals of experiential approach is facilitate individual autonomy and sense of belonging in the family, help individuals to achieve more intimacy, encourage family members to be themselves by freely expressing what they are thinking and feeling. The therapist focused on developing a genuine and congruent relationship with the family while facilitating and encouraging the growth and change of the family members. The next is relationship counseling or relationship approach. This approach is based on all relationships can struggle and go through difficult times with the conflicts. Relationship counseling or couple relationship counseling is one of the important approach in family therapy at times of most challenging by the couples. In couple counseling, both couple have an opportunity to explore a variety of past and present patterns of relating that may have been getting in the way of enjoying closeness and intimacy with the partners. The techniques included in the relationship counseling, first one is explore the story, second one is understand the story or problems and changing the pattern. So explore the story, understand the story and changing the pattern of relationship and communication. Next is Anderson's social constructionist approach. Herlin Anderson emphasized collaboration in her writings about therapeutic process. So social constructionism is best described as a philosophical stance that, if adopted, orient us to the world in a relational, that is just opposed to individualist manner. So according to Anderson, social constructionism is best described as a philosophical stance that, if adopted, it orients us to the world of in a relational world that is just opposed to individualist manner. As a philosophical stance, social construction assumes that meaning emerges in what people do together, that is the social relationship. According to Anderson, quality of a person are assumed to be located within the person. Social construction views these qualities as emergent byproducts of human interaction. The focus for the social constructionist approach is therefore on interactions, what people do together, and second is on what their interactions generate. According to Anderson, the therapy itself is a process of social constructions. So he believes healing comes from social interactions. Next is psychoanalytic approach. The goal for psychoanalytic approach is guide the family members who exhibit pathology into clarifying old misunderstanding and misinterpretations between themselves and parents, between the members of the family of origin, and establishing an adult-to-adult relationship or good bond. According to this approach, family members are affected by each member's psychological makeup. Thus, problem arises when there is an internalization or introjections of parental figures. Thus, this approach helps the family members to establish a good adult-to-adult relationship. The seventh approach is Integrative Approach. Integrative Approach is developed by Nathan Ackerman. He is considered as a grandfather of family therapy. The overall goal of Integrative Approach is remove pathogenic or intrapersonal conflict and promote more healthy relationship within the family. And this approach is focused on family values. That is, a problem arises when intrapersonal conflict is internalized by the client and it becomes later an interpersonal conflict. So individual problem later become the group problems. The next approach is Elli's cognitive behaviorist approach. The goal is behavioral change by positive reinforcement. Individual learns that she or he obtains satisfaction or rewards from certain response for other family members or other individuals. Problem arises when maladaptive behavior is learned and reinforced by the family. So this approach is direct and clearly stated in bringing change in behavior of the family members. So here this approach focused to change the behavior of the family members. Next is structural approach. This approach is developed by Salvador Munichin. According to Salvador Munichin, family is a system of individuals. Problem arises if family boundaries become enmeshed or disengaged and can't cope with the change. The goal of this approach is develop clear boundaries for individual members and changing the family structural pattern. So develop a clear boundaries for the individual members of the family and changing the family structural pattern. Structural approach identifies and reorders the organization of the family system. It identifies and reorders the organization of the family system. This is a short-term therapy and action-oriented therapy, which with the focus of changing family organization and social context. So these are the 9 approaches of family therapy or family counseling. Next is stages of family therapy. Stages of family therapy. There are mainly three stages in family therapy: the initial interview, the intervention or working phase, and termination phase. Initial interview, intervention or working phase, and termination phase. First is initial interview. There are 5 stages in initial interview, that is engagement stage, assessment stage, exploration stage, goal setting stage, and termination stage. Engagement stage is the initial interaction between the family members and the therapist. Second is the assessment stage. Activities of assessment stage includes: first is construct of a family genogram. First construct a family genogram. Then describe the family. That is the description of the family in relation to the community and focusing the ethnicity of the family, socio-economic background or class, educational level, and religions, etc. So description of the family. Then description of the presenting problems. So describing the presenting problems with focusing on the each family member's perception towards the problem. Then identification of the communication patterns of the family members. Fifth step is identification of roles of each family members. Then the sixth one is making developmental history of the family and developmental history of the presenting problem. The seventh step is understanding the family's expectation of therapy. So these are the 7 different steps in family assessment. Family assessment includes 6 elements. First one is communication, second one is self-concept reinforcement, family members' expectations, handling differences by the family members, family interactional patterns, and family climate. So after the assessment stage, the next stage is exploration stage. Here the therapist make the family members to understand their problem and create an insight among the family members. Then together they make a goal, that is the goal setting stage, and finally they solve the problem by making a good communication and a relationship among the family members, that is the termination stage. The second phase of family counseling or family therapy is intervention or working phase. The goal of the intervention phase is to help the family to accept and adjust to the change. Working phase usually occurs or generally occurs once a week only. Here the therapist role is to clarify and interpret the communication as well as to offer suggestions and guidance to the family members. The last phase is termination phase. If the family has achieved the goals and identified specific problems have been resolved, then it is a time to initiate the termination phase or closing the family therapy or family counseling. So this is the termination phase. The next session is benefits of family therapy or family counseling. I have made a mnemonic. Benefits of family counseling is crush the physical and mental stress. Crush the physical and mental stress. Let us expand one by one. C stands for communication improvement, R stands for relationship enhancement, U stands for understanding and solving the problem, S stands for self-esteem building, H stands for happy family or happier family, physical and mental stands for physical and mental health, stress stands for successful family. So let us explain in detail. The benefits of family therapy or family counseling is, first one is communication improvement, improvement of the communication among the family members. Then enhancement of the relationship, that is relationship enhancement. Understanding the problems and solving the problems. Then building the self-esteem among the family members, that is self-esteem building. Then make the family so happier, happy family. Then promote the mental and physical health of the each family member. Then finally successful family and successful marriage. So these are the benefits of family counseling or family therapy. Next is the contraindication of family counseling. The contraindication of family counseling includes, one is family factor. Family factor means the prejudicial customs, traditions, beliefs of the family. They are not ready to change that. Second one is family in the process of breaking up. Family are in process of breaking up. Family with the tense and dysfunctional equilibrium. Family staying apart. No availability of the key family member and unwillingness to accept the therapy. These are the contraindication for family therapy. So the last session of the day is role and functions of a community health nurse in family therapy. Role and functions of a community health nurse in family therapy. The role and functions of a community health nurse in family therapy includes, first of all, the community health nurses act as a co-therapist in a family therapy or family counseling, and she has a key role in family therapy and family counseling. So the first role is to assess the type of the family, whether the family is functional or whether the family is dysfunctional with a particular problem. Assess the family's relationship and communication pattern. Then assist the therapist in identifying the type of the therapy. Develop a clear contact with the family members. Encourage the family members to have a self-change. Limit the actions of the community health nurse according to the agency policy. Then set up the norms, values and roles for the family members. Then help the family members to find and solve the problem by themselves. Help the family to find and solve the problems by themselves. So these are the 8 important role and functions of a community health nurse in family therapy or family counseling. So far we have discussed about the family therapy and family counseling. We have discussed about the meaning, definition, family stressors, that is general and developmental stressors, goals of the family counseling or family therapy, aims, indications, principles of family therapy or family counseling, types of family therapy, functions of family therapy, then techniques of the family therapy and approaches, various approaches of family therapy, stages of family therapy, benefits, contraindications and important role and functions of the community health nurse in family therapy or family counseling. So thanks for watching. I hope this video really benefits in your studies. If you feel it is worth and really beneficial, please like, share and subscribe on my channel. Stay tuned with the Angel Health Academy till we meet with another important educational video. Thank you.